Hi everyone, it's Kate Milliken, the founder of MyCounterpane, and this is a MyCounterpane one-on-one. This afternoon, I am speaking to Dr. Dr Farrell, who is a licensed clinical psychologist and published author with experience in the field of mental health as a practicing clinician, a medical writer, a researcher, an educator, and a disability consultant. Dr. Farrell, we're thrilled to have you here. You have written a number of books, one of them about sleep we'll talk about, which is your newest book. An earlier book you wrote is called It's Not All in Your Head, which was specifically geared for people living with MS. I would love for you to tell our viewers your past experience and how you got involved with MS in the first place.
I had always been involved in or interested in physical illness and fought my colleagues who never, always thought it was psychological. And then I started really seeing people who had MS and had other illnesses. And I realized, yes, this is really caused by physical problems they're having, causing psychological problems. And that was something that I really wanted to delve into. MS just kind of came on the scene. It was very interesting. And somebody just asked me to do something and I did it. And I said, yes, has to be written about.
So from your experience, you actually saw a number of cases of people living with MS who went to a doctor or somebody to help them. And the doctor's response was, you're crazy, you're having psychological.
Oh, yes, absolutely.
And that was the impetus.
Unfortunately, it was poo-pooing time. And, poor little you're a woman who can't handle something. It was just terrible. They were destroying these patients by actually saying that. And when they would come to me, I would say, no, that's not right. We have to educate those doctors. We have to educate everybody.
With writing this book, It's Not All in Your Head, coming from a background of specializing in mental health and anxiety, what are some of the things that you saw through the lens of MS, how anxiety manifested?
Well, certainly one of the biggest parts of anxiety is you don't trust yourself. You don't believe in yourself. Anxiety really is, I call it, it's a devil. It's a real devil that attacks your self-esteem. And that just plays out. You become anxious. You don't want to see people anymore because you're afraid that you'll make a mistake. You'll mispronounce a word. You'll forget something. Yet you conjure up all of these horrific things that could happen. And so anxiety gradually closes your world down to the point where you're not really doing very much anymore. And you feel that you are the fault. You're the blame. You accept all of that. And what you have to understand is, no, you're not at fault. You're not to blame. You shouldn't be accepting that. People should be supporting you. Yes, you will make mistakes. Yes, you will forget words. Yes, you will stumble. But you know what? We all do. You stumble a little more. Okay, we all do. That's part of the normal for you. And okay, you wouldn't want to be that way. And you're going to ask yourself another question that other people say all the time. Why me? You didn't do anything wrong. You are not to be blamed. You need to understand that. And every time you begin to say that, you need to say, no, I'm not to blame. No, I did nothing wrong. I'm fine. I've got an illness. I'm fighting. And as long as I'm alive, I'm fighting. And you do that. And that is going to help you. It's going to help you as much as medicine.
I remember in my own MS experience, really hanging on to someone who had given me very similar advice. And every time that having a negative thought out loud, saying the word out,
yes,
to try to kind of make a clearer pathway.
Absolutely.
In light of that anxiety, and I think it's a wonderful way of characterizing it, that it's a direct attack on your self-esteem. How does anxiety compare to stress, which is something I feel everybody in this day and age deals with? Can you tell me if there's a difference, especially for people living with MS?
Well, stress is really, it's a peculiar thing. Stress and anxiety both have good parts and bad parts. You have to that's professor a long time ago told me. If you want to think about a mountain or you think about a hill that goes up like this, okay? Now up here, you're in trouble. You've got high stress, high anxiety. Stress really takes over your body. It's really a physical reaction and then a psychological reaction to something. What your body does, it gets ready to protect itself, but it doesn't realize that the protection that it is trying to get is inward, and that it's something that you have to protect in a different way. Because what happens when you get stressed, very interesting, your body gets prepared for battle, a physical battle. Your pulse rate goes up, your heart rate goes up, your body temperature will probably change a little bit, and even the blood supply in your body when you are stressed. I'll tell you a little secret. When you are stressed, feel your hands. If your fingers are cool, really cool, what happens is the blood is now going into the middle of your body, leaving the external parts of your body, so that if you have to release a lot of energy from your liver or something like that, or even if you get a wound, you will be able to handle it physiologically. Stress is part of life. There's no way you can get around it. No way. There's something called the life stress scale. It's in the book. You look at it and you will say, "Wait, come on, I had a baby. Why is the stress level? I got married. Why is the stress level so high? I got a promotion. I went on a vacation." Good and bad. It's a change in your environment. It's a change in the things you either have to do or the things you believe you have to do. And that causes this physical change. Stress is bad for your immune system.
Right. So what do you advise for people in your book, or generally, knowing that you're not a official medical professional giving advice, what do you recommend for people to combat stress in the face of their MS?
The simplest thing for you to do is allow yourself a few seconds. Whatever's going on, I don't care what it is, whatever's going on, take a few seconds and learn deep relaxation breathing. Relaxation breathing, and I have a video on YouTube if you want to take a look at it. Very simple. It will take you a few minutes and you will physically cause your body to calm down. It has an incredible effect. It's not just psychological, it's physical. You do that, and while you're doing that or after you're doing it, you say, "Okay, fine, now wait a minute. Let's look at this with a new perspective. Okay, what can I do? There's some things you can't do anything about, but how can I handle this in a different way so that I don't have to feel that I have to run, I have to do something, whatever. I'm absolutely at sea about
like
this."
Fast,
right?
out of your control, I can't keep up.
Exactly. Allow yourself to be normal. Allow yourself to say, "Look, everybody gets stressed, and they all get stressed about this. I just need to help myself. I don't have to worry about anybody else. If they're telling me, 'Oh, what's the matter with you? Why can't you handle this?' You don't have to answer them. Just take care of yourself. You don't owe anybody an explanation. Stop, walk slowly, and I would recommend that. Walk slowly, because your body will react to that. If you run around, you're going to get your body worked up. You're going to start yourself getting even a higher level of stress. So you help yourself in little ways. You don't have to do anything dramatic.
One of the things that I like that you mentioned, besides the physical tips, is this whole idea of the power of perspective, which I think is really important. One of the other things you bring up in your book, which I adore, is the whole idea of the power of possibility. Can you talk to me about that?
Well, I think you know that there are things you can do. You may not be able to do them as before, but that does not mean you cannot do something. That does mean you cannot plan something. You may have to change it a little bit, but you always have power. You are not kind of devoid of power because of this illness. It will not take over your life. You have a say in this, and just remember that. If you have to remind yourself, and I say, you know what? Say it out loud. You know why? You say it out loud. You have to bring the voice up through the throat. You have to make it through the mouth, and then has to go in the ears and get processed by the brain. You actually help yourself understand it better if you say it out loud. People don't like it. You just say, look, that's something I do. It helps me.
Right.
And
A
that
mantra.
flows.
It's a
Right.
mantra of sorts. That's
That's
great.
exactly it.
I think there's enormous power, more and more in the MS world. I think that there's been a
Oh,
real
yes.
traditional clinical view of what makes you better and what doesn't make you better if it isn't clinically tested per se.
Right.
And more, the MS world is opening up their spectrum to being more open-minded to things such as exercise,
Absolutely.
diet, whatever else.
Oh, yes.
I would really love to talk about the idea of taking care of yourself. And one of them, of course, is the subject of your newest book, sleep. So I'd love to give, as people are progressing with their MS, no matter where they are on their journey,
Mm-hmm.
for them to actually believe they can do things proactively to make themselves better.
Mm-hmm.
Would love to hear your tips on sleep and beyond.
Mm-hmm. Well, I think, unfortunately, we poo-poo sleep. We live in a world that says, oh, no, you have to be multitasking. You have to be Superwoman or Superman or whatever. Oh, come on. So-and-so says they only need 2 hours sleep a night. They only need 4. What's the matter with you? Why do you need 7 hours sleep a night? Well, excuse me. That's normal. These people, unfortunately, will pay a price, or maybe they're wired differently. I don't know. We know that Leonardo da Vinci, yes, it was Leonardo da Vinci, used to sleep only 15 minutes at a time. He had these micro sleeps, but he did it all day long. So did Thomas Edison. He did it all day long. He napped all day long and he got up and he worked. Okay, fine. If you want to do that, well, you could try it. But I would recommend that you try to get 7 hours sleep. And in the book, it talks about something that every sleep researcher, anybody in a sleep center will tell you. You have to learn to practice sleep hygiene. And that means you need to be in a quiet, darkened place. You need to have it cooler, actually, because you sleep better when it's cooler. You need to maybe use a sleep mask. Some people have difficulty because their eyelids really allow too much light through, even when it's closed. You need to help yourself maybe imagine that you're going away to a wonderful place you've been before. Allow yourself to use a little bit of that. Allow yourself to say, look, you know what? This is my job right now. I have to just learn to relax, enjoy. This is for me, and it's okay for me to do it.
You honor it.
Absolutely, absolutely. And never exercise before you're going to go to sleep at night. It works you up too much. Never drink. Well, actually, very interesting. Some people have found drinking coffee right before they go to sleep actually helps them go to sleep.
Wow.
That sounds strange, but some pediatricians even recommend it for children. It's a paradoxical effect. So sometimes you try out some of these things that don't sound exactly like they're going to work, but they work for you, and you've hit the right connection for you. So
I think there's something very valid about making a choice on how you're going to better yourself and finding out what does work for you.
absolutely.
Certainly in MS, every case is individual. So
Yes.
figuring that out is great. And I feel like, I kind of wanted to close our talk. You had an incredible quote in It's Not All in Your Head, which I just like to read, where you talk about how you hope that this book will help people living with MS to self-direct themselves, to self-alleviate some of the emotional symptoms related to MS. So with that quote, can you explain to me what an emotional symptom is?
It's really when you find yourself really getting caught up. You find yourself you almost become paralyzed from the anxiety or the mood that you're in, and you can't seem to break out. And it's really the illness. It's an illness. We have to call it that. We don't even know what causes it, but it is an illness. And you have to break out of the illness and say, okay, take a few minutes. Take a few breaths. You can go there. Yes, you can be a coach to yourself. You're going to be your best coach. You know what works for you, and try it. Do it. You have to write it on the refrigerator. Do it. You have to put it someplace else in your car. I don't care. Do it. It doesn't matter if it sounds wacky. Do it. If it works for you, that's it.
What for you and your experience with speaking with people living with MS has been the thing you're most impressed by?
Oh, the fact that they will get up and try. They won't let it really get them. A young woman in college, she wouldn't let them say to her, no, you won't be able to do it. She said, no, I'm going to finish school. Yeah, I feel rotten. Yes, I'm having trouble. But you know what? If I have to do it twice or 3 times or whatever to learn the material, I'm going to do it. And she did it. I mean, I praise her to the skies. And actually, this man who's going to be 80 next month, I praise him also. Yes.
It sounds like you've been lucky enough to meet some really resilient people in the face of MS, which is wonderful.
Yes.
Dr. Farrell, you've been wonderful. Thank you so much for your time. And to everyone viewing this My Counterpane one-on-one, we'll see you next time.